What if I told you most doctors don't realize which antibiotics are most likely to trigger a C. difficile infection? The truth is, you could be handed one of these prescriptions by your family doctor, your dentist, or even in the ER room without being notified of the risks of these antibiotics. In this video, you'll discover the truth about antibiotics and C. diff. In this video, I'll be covering what is C. diff and why antibiotics trigger it, the top 5 antibiotics most likely to cause C. difficile, what are the lower risk antibiotics. I'm also going to talk about antibiotic course length and relapse risk, and also who's most at risk after taking antibiotics. And lastly, what are the key takeaways and questions you can ask your doctor? Welcome, I'm Michelle Moore, and I'm a microbiologist, but I'm not a medical doctor. This video is for educational purposes and should not be considered medical advice. Antibiotics can be life-saving, but they also carry risks, including C. difficile infections. If you need guidance on which antibiotics are right for you or how to protect your gut during an antibiotic course, please talk to your healthcare provider or your doctor. And remember, never stop or change your antibiotic without first consulting your doctor. C. diff or C. difficile is a bacteria. It's normally found in the environment, and it's also in some people's GI systems where it doesn't cause any kind of symptoms or problems. About 2 to 5% of healthy adults and up to 20% of hospitalized patients can carry C. difficile in their colon, again without causing any symptoms. However, the real problem starts when antibiotics come into the picture. Antibiotics are medicines designed to kill bacteria, but not all antibiotics are the same. Some antibiotics work by punching holes into the bacteria cell wall, and others can stop them from making necessary proteins or even from copying their DNA strands. And just like their methods differ, so does their range. Some antibiotics are broad spectrum, and they work to wipe out all kinds of bacteria at once, while other antibiotics are a narrow spectrum and they work more selectively or against specific bacteria. The difference here is really important because broad spectrum antibiotics carry a much higher risk for C. difficile infections to develop. Antibiotics don't just kill the bad bugs that they are prescribed for. They actually also kill your healthy, good gut flora in your GI system, and those are the bacteria that work to keep C. difficile in check. When that healthy balance is lost, the C. difficile bacteria can quickly overgrow. They'll produce toxins, which then trigger the symptoms of C. difficile, which can include the watery diarrhea, cramping, fever, and even in more severe cases, an inflammation of the colon. I often like to think of it this way, is your gut is like a really busy garden that's full of flowers and vegetable plants, but also has weeds. And you come in with a broad spectrum antibiotic, which is like the weed killer. Well, it does go around, it kills the weeds, but unfortunately it also kills the plants and the vegetables that have been keeping the weeds under control. So then you have an overgrowth of the weeds. They suddenly pop out, and in this case, the weeds are C. difficile, where they just can take over the garden. And that's why some antibiotics have a much higher chance of triggering C. difficile. So in the next chapter, I'm going to discuss the top 5 antibiotics that can trigger a C. difficile infection. So which antibiotics show up again and again in research and also in real people's stories? Well, pretty much every day we hear from people who have taken an antibiotic and then ended up with C. diff. We hear stories like this all the time, such as, I took clindamycin for dental work, and a few weeks later I got slammed with diarrhea and ended up in the emergency room. I wish I would have known sooner. Or I was prescribed Cipro for a UTI infection, and by day 5 I had nonstop watery stools, nausea, dehydration. It happens so fast. Studies consistently point to a top 5 that carry the highest risk of C. diff. But keep in mind, as I share these names with you, each antibiotic carries at least 3 names. It'll have the chemical name for the drug, a generic name, and also a brand name. So that means that each drug may look like 3 different kinds of drugs if you're reading the prescription or if you're reading an article about that drug. So it can be confusing to know exactly which drug is being talked about. So the first worst offender is clindamycin or Cleocin. In a study of over 36 million outpatient records, clindamycin actually carried one of the strongest links to C. difficile infections, raising the risk more than 8 times compared to safer options like doxycycline. The one thing about clindamycin is that C. difficile can actually start weeks later after you finish the antibiotic. Next are the fluoroquinolone antibiotic group. This includes drugs like ciprofloxacin, which is also known as Cipro, and levofloxacin, which is often called Levaquin. Now, these drugs are often prescribed for urinary tract infections or UTIs, as well as respiratory infections, and many people report their C. diff began after a round of Cipro. Now, in third place are the 3rd and 4th generation cephalosporins. This includes drugs like cefdinir, cefuroxime, and ceftriaxone. Now, these broad-spectrum antibiotics wipe out a wide swath of gut flora, leaving plenty of room for C. difficile to grow. Now, 4th on this list are the broad-spectrum penicillin combinations such as amoxicillin clavulanate. This also goes by the brand name Augmentin. Now, this drug is widely prescribed for sinus infections, ear infections, and respiratory tract infections, and it has been flagged as a common trigger for C. diff. Also notable in this group is piperacillin tazobactam, which also goes by the brand name Zosyn, but this one is mainly used in hospital settings. And in 5th place are the carbapenems, and that includes the drug called meropenem, and these are often reserved for hospital use, but when given, they carry a high C. diff risk. And as a side note, for some of you who are dealing with staph or MRSA infections, some of the antibiotics used for these infections or historically used also sit in the high-risk bucket for C. difficile. So first off is clindamycin, and this is a big standout drug. It's been widely prescribed for skin and dental infections, but large U.S. dataset studies shows it actually carries one of the strongest C. diff risks. Now, it is active against susceptible MRSA and also staph infections, at least at the time of filming this video. Also in this list are certain fluoroquinolones like ciprofloxacin and levofloxacin. These can also raise the risk of C. difficile. Now, these both have historically been used for MRSA staph, but resistance is high, and these antibiotics are not as reliable at this time. There's also some broader cephalosporins like ceftriaxone and cefepime. These are sometimes used in hospital settings when staph, but not MRSA, are suspected, and these are also linked to higher C. diff risk. And lastly is the amoxicillin clavulanate or the Augmentin brand name drug, and other beta-lactam, beta-lactamase inhibitor combinations. These are sometimes used for staph infection, but MRSA is resistant to these. And these drugs, like Augmentin, are also linked with higher C. difficile rates. If you had a culture or susceptibility test done on your infection, and if it offers multiple antibiotic options, this is where it's worth asking your doctor about a narrower coverage antibiotic and using the shortest effective course for that drug. Now let's talk about the other side of the spectrum. People often ask about what antibiotics can be used that carry a lower risk of causing C. difficile. Just remember that almost all antibiotics can increase your risk for C. difficile, and low risk does not mean no risk. So one class with a lower risk includes the tetracyclines, especially doxycycline and minocycline. And in fact, research published in Gut Microbes in 2022 showed that doxycycline was one of the least likely antibiotics to set off a C. difficile infection. Now, another antibiotic in this lower risk category is nitrofurantoin. Now, this one is often prescribed for urinary tract infections. While it isn't completely risk-free, there's a large U.S. study of more than 36 million outpatients. They found that its risk was much lower compared to broad-spectrum drugs like clindamycin or cephalosporins. But even these lower-risk drugs are not without their problems. For nearly 4 years, I suffered with recurring staph infections, and I was prescribed antibiotic after antibiotic after antibiotic for many years. And even though these antibiotics I were given were lower risk, they weren't without their problems. Over the years, I started getting more fatigue, I started having more gut issues, and I was just having a hard time recovering my health in general. And it wasn't until I started digging into the science of the microbiome that I started realizing the repeated use and overuse, even of low-risk antibiotics, definitely take their toll. So I also want to include some information here if you are dealing with MRSA or staph about what some of the lower risk antibiotics are for those infections. One of the first lower risk antibiotics is tetracyclines if the staph is susceptible to it. That can include doxycycline and minocycline. These both tend to show lower C. diff association compared with drugs like clindamycin or broad cephalosporins. Now, another common option for MRSA is trimethoprim sulfamethoxazole. Thankfully, this one is often abbreviated as TMP-SMX because even that one is a tongue twister for microbiologists. Now, this TMP-SMX is also known by the brand name Bactrim. Now, this antibiotic generally sits lower on the C. diff risk spectrum than the high-risk agents, though it's not risk-free. And last on this list is linezolid, or Zyvox is a brand name. Now, this is another MRSA-active antibiotic. It's often reserved for serious infections, and thankfully it's not in the highest risk classes flagged for C. diff in outpatient studies. Now, vancomycin is widely used. The oral form actually treats C. difficile infections, but the IV form, the intravenous form, is used for MRSA, and neither forms of vancomycin is considered a top trigger for causing C. difficile. Now, the bottom line is when culture results allow that these antibiotic choices paired with doing a shorter duration of the treatment period, these both can help reduce gut fallout. Of course, none of these options are risk-free, but they're generally considered less likely to trigger C. diff than the high-risk antibiotic classes. One of the most overlooked factors in getting C. difficile isn't just which antibiotic you take, but it's how long you're on the antibiotic and how many times you've taken that antibiotic. If you need a short, single course of antibiotics, your risk is lower, but it's never zero. Even one round of antibiotics can sometimes trigger C. difficile. But when the courses get longer, the risk goes up. A Canadian case cohort study in clinical infectious diseases found that a 10-day antibiotic course raised C. diff risk by 12%, and a 14-day course raised it by 27% compared to a shorter 7-day course. Now, the danger climbs even higher with repeated courses of antibiotics. Each new prescription disrupts your gut a little bit more, and the odds of relapse stack higher every time. I know this cycle personally because I spent nearly 4 years on antibiotic after antibiotic, and that experience mirrors what the research shows. It's not just the type of antibiotic, but the duration and repetition that can tip the balance. Now, for people who have a history of C. difficile, the risk of recurrence is the highest of all. About 20 to 30% of patients relapse after their first episode, and the risk rises with every recurrence. Now, finally, keep in mind that broad-spectrum antibiotics, the kind that wipe out a wide range of bacteria, they tend to carry more risk simply because they leave the gut more vulnerable. Now, next we'll look at who is most at risk after taking antibiotics, and why some people get hit harder than others. Thankfully, not everybody who takes an antibiotic ends up with C. difficile, so you might be wondering, well, who is most at risk? Now, one of the strongest risk factors is having C. difficile beforehand. People who've already had a C. difficile infection face much higher odds of catching it again. Recurrence rates are reported at 20 to 30% after a first infection and increase after subsequent ones. In many studies, prior C. diff history is one of the most consistent predictors of relapse. Now, another factor is age. Studies show age, especially people over 65, are several times more likely to develop C. difficile after antibiotics compared to younger adults. The Centers for Disease Control, the CDC, they even highlight this age group as the most vulnerable. Now, another risk factor is hospital or nursing home stays, and especially if you've been in the intensive care unit or if you've had other serious health issues. Being in these settings often means you've been exposed to more antibiotics and sometimes to more C. diff spores themselves. As studies actually show, people in these facilities have a much higher C. diff colonization rate than the general public does. And another really big risk factor is the use of proton pump inhibitors. Now, this is a medication often taken for acid reflux. And this shows up in research as raising the risk of C. diff because it lowers the stomach acid. Now, that stomach acid is a barrier to infection, and it helps protect against C. diff and other kinds of infections. And lastly, here's another thing that most people don't realize. The risk doesn't stop the day you finish your antibiotic. In fact, a large study done in the Netherlands showed that the danger of developing C. difficile was highest while you were taking antibiotics, but it remained elevated for up to 3 months after stopping the course of antibiotics. And that's one reason you'll see so many people in online forums saying that they thought they were in the clear only to relapse into C. diff weeks later. Now, there's a few other secondary risk factors that are worth mentioning here. People with underlying illnesses, especially autoimmune conditions, and those who are undergoing chemotherapy may be hit harder after using antibiotics. Now, these kind of conditions can weaken your defenses and increase your risk for C. difficile. So it's important to remember that not all antibiotics carry the same risk for C. difficile. Antibiotics like clindamycin, fluoroquinolones, they can carry the higher risk of getting a C. difficile infection, while antibiotics like doxycycline carry a lower risk for C. difficile. The risk is also tied to the length of duration of your antibiotic course and how many repeated uses of the antibiotics you've taken. Third, your age, your health status, and your history do matter. If you've had C. diff before, if you're over 65 years of age, or if you're taking acid reduction medications like those PPIs, your risk goes up. These same risk factors and treatment choices are actually outlined in the latest guidelines from the Infectious Disease Society of America. These are the clinical guidelines for antibiotics and C. difficile infections. A good doctor should be aware of these treatment guidelines as well as your history, so you're not prescribed the very antibiotics that could make things grow worse. So here are 6 questions you can ask your healthcare provider, whether that's your doctor, your surgeon, or your dentist, before they fill out your next prescription. Is this antibiotic really necessary, or are there safer alternatives? Could this drug increase my risk for a C. difficile infection? Are there lower risk antibiotics that could still work for my condition? Is an antibiotic susceptibility test advisable before prescribing? And this is a test where they check and actually culture and grow your infection, and they test it against various antibiotics to see which ones actually work. Another question: what are the side effects and precautions for this antibiotic, especially related to gut health? And lastly, can I make my treatment decision at home instead of rushing into it here in the office? Now, even asking just one of these important questions can shift the conversation and give you peace of mind. And just to be clear, the antibiotics we've covered today that have the higher risk for C. difficile, they aren't inherently bad. They don't always cause C. difficile, and sometimes they're exactly the right choice. Their mode of action, their effectiveness against certain infections, or the antibiotic resistance patterns in your area may make them the perfect choice. The most important thing is knowing the risks, asking good questions, and working with your healthcare provider so you can make together the most informed decision for your unique condition. Another important thing is that there are ways to support your body and potentially reduce antibiotic side effects and C. difficile risks, and I'll be talking about that in the next section. And one more important thing to remember: don't overlook antibiotics prescribed at your dental office. Studies show that dentists account for a surprising number of antibiotic prescriptions, and as many as 15% of all C. difficile infections are tied to dental antibiotics. So if your dentist, your oral surgeon, or your endodontist wants to prescribe antibiotics, it's worth asking what your options are and if there are lower risk antibiotics you can take. So now you know which antibiotics carry the highest risk for C. difficile and what questions you can ask your doctor. But here's the thing: even if you avoid those high-risk drugs, antibiotics of all sorts can create another problem, and that's diarrhea. Now, diarrhea in itself doesn't mean you have C. diff, but it is a very common side effect of antibiotic drugs. And it's not just uncomfortable, it's one of the first signs your gut balance is breaking down. And that's why I put together this video here on why antibiotics cause diarrhea and what exactly you can do about it.